We are reporting on the 15-year follow-up of a frontline study for follicular lymphoma. This is a SWOG-S0016 study, which, as I mentioned, now has 15 years of follow-up. And what we're trying to do in this oral presentation again at the Lugano meeting is to show that, number one, what is the benchmark for chemoimmunotherapy in the first-line setting of follicular lymphoma? Despite all the advancements that we had in follicular lymphoma field, the standard of care remains to be chemoimmunotherapy. As the novel agents are introduced and we try to bring them to the first line, it's extremely important to know what is the benchmark for the first line setting. So long-term follow-up is critical. And the S0016 study was a randomized study. Patients with advanced follicular lymphoma who needed treatment were randomized at the time to either receive R-CHOP as a standard of care or CHOP with a CD20 antibody labeled with iodine-131 as a radioimmunotherapy addition to the CHOP backbone. And the study was a randomized study. Maintenance therapy was not part of this regimen. So now, after 15 years of follow-up, not only we are seeing an amazing overall survival of 70% and a PFS, progression-free survival of 40% in all patients, which is important as a benchmark, we're also looking at an important question of whether or not some of the patients with follicular lymphoma could functionally be cured of disease. So we don't believe that in follicular lymphoma we can talk about cure, and maybe from the biological standpoint, cure is not achievable in follicular lymphoma. However, we also know that the time of diagnosis or age of diagnosis is 70. So if you use a regimen that induces a remission that's longer than the life expectancy of a patient, then functionally you can talk about a functional cure, meaning that the patient may never need a treatment for that follicular lymphoma diagnosis. So the interesting finding is that over time, and when we look at the first 5 years and then 5 to 10 years and 10 to 15 and then 15 to 20, the average rate of progression drops significantly. And at some point you see this curve that looks at patients with progression or death from lymphoma. That curve starts to plateau at some point. And basically the message is that yes, there are patients who may never have a complication from lymphoma in terms of relapse and death, and maybe we can use this argument that some of the patients are functionally cured. Now, of course, we have to be careful, but this is the longest follow-up at a first-line or a front-line follicular lymphoma that used chemoimmunotherapy is using, and I think it's an important finding for the lymphoma community to discuss, and maybe other clinical trials can generate the same data, and we may come up with some agreement on using this functional cure terminology.